we can do to make it better. Avoid alcohol, especially in the evening. Sedatives, pain medications in the evening can contribute. Pain medication, I'm talking about like morphine and those serious Vicodin, Tylenol 3, but not the regular over-the-counter medications. Because sedatives can cause more relaxation to the muscles and eventually lead to serious results as far as snoring. Sleep deprivation is definitely a serious contributing factor to snoring. We see more frequent snoring when patients that have bad sleep habits and when they're sleep deprived in general. I see actually maybe college students, they sleep 4 hours and they're good to go, but they're sleep deprived, big picture, and those patients tend to have a lot of snoring. And when they improve their sleeping habits and schedule, they tend to do better. Weight loss is very significant again because the mechanism of the snoring has to do with the back of the, narrower passages. The treatment, first lifestyle changes, like I said, improving sleep hygiene, sleep habits, weight loss, avoid alcohol. Sleep position, again, when you sleep on your back, the chances of snoring are much higher. If you sleep on your side, and it's pure snoring, tend to get better. In fact, even sleep apnea tend to get better when you sleep on your side because you don't have all this, soft tissues, including the tongue, pushing on the air passages. Then if again, we're talking about pure snoring at this point. Oral appliances is to be considered as a treatment, and I'll go over oral appliances in a second, but oral appliances, the problem with it that it's a device that the mechanism of oral appliances is a device that lays on teeth and tend to push the jaw forward to improve this air or make this area wider and improve the airflow. Again, this is oral appliances, so it pushes the jaw forward and improve the airflow. The problem with this device that this is about $5,000, and it's very expensive, and insurance wouldn't pay for it for snoring only. So this is one of the problems. There is the positive pressure devices like the CPAP, the machine that pushes air that go through the airways to create a positive pressure here and keep this area kind of stented open. We use those devices all the time for sleep apnea because insurance pays for it, but those are expensive things, and this is one of my problems. So, end of the day, most of my patients, we tend to work on lifestyle modification and weight loss and those parameters. And when it's causing serious problems and we cannot achieve the weight loss because it's not easy, we give our patients those options. Now, surgical interventions, there is multiple surgeries where we're used to help with snoring. Again, insurance will not pay for those surgeries, and that's a huge limiting factor. Those are very expensive interventions. But sometimes if a patient has, tonsillar hypertrophy, they have, and those are options I give to the patients. They can shave actually the soft palate, take the tonsils. Does this work? Statistically speaking, for snoring only, not for sleep apnea, it works about 70% of the time. For sleep apnea, work between 30 and 50% of the time. It's not great. That means that after all this surgery and expenses, and patient continues to snore, that's a big thing. So we are a little reluctant to do those. There is a smaller interventions like laser surgery. They kind of tend to do radio frequency or laser to the back, to the base of the tongue, or to the soft. They do surgery to shave the soft palate. Again, those are expensive, and insurance doesn't cover for it. One of the other, I use this more frequently because it's cheaper, the CPAP. There is a device, we call it auto CPAP, which does not require, too much sleep studies. It's just a device that gives you, range of pressure that, you know, I prescribe. The patient tend to, usually they buy it from online websites, and it's cheap, but it does work. And I set the pressure for the patient. We don't do that much frequently, but again, sometimes it's, you know, we are desperate and we do that.